Hello, and welcome to the Clinical Update podcast, the podcast that brings you thought-provoking clinical education from MIMS Learning that you can fit into your busy life. I'm Pat, editor of MIMS Learning, and I'm delighted to have with me today Dr Kamilla Kamaruddin, who's GP lead clinician at East of England Gender Services. Welcome, Dr Kamaruddin.
Thank you and hello.
We're going to talk today about transgender healthcare, drawing on Dr Kamaruddin's lived experience and provide tips for GPs about what they can do to provide support. I was inspired to contact her because of survey results that indicate a lack of knowledge and training amongst healthcare professionals in this area. For example, successive transactual reports have revealed poor experiences of healthcare amongst patients, and this is linked to a transactional healthcare professionals report showing that less than a third of healthcare professional respondents felt that they'd received sufficient medical training or supervision to support their trans patients. So with this podcast, drawing on Dr Kamaruddin's lived experience, we hope to provide some takeaways for practice as well as signposts to useful resources. So welcome again, Dr Kamaruddin. And first of all, could you tell us a little bit about yourself?
Okay, all right. Where do I start? At the moment, I'm a GP in transgender healthcare and also clinical lead at East of England Gender Service. I have been in this role for the past 6 years. I am very, very happy with this role. It's a very safe environment for me to work, as I am also a trans person. And with this role, I have the opportunities to thrive even more. So yeah, it has been a privilege for me to work in transgender healthcare.
Brilliant. So where did your journey start in terms of transitioning?
I think this is a useful question, mainly because actually to educate GPs about the struggles that trans people face. And I am trying to share my experience. I must say that my experience is very different from other trans people. So every trans person have their own experience, but the experience always starts with difficulties, with lacking of support, and also starts with some, with mental health issues too as well. I think my journey begins when I was actually 5 or 6, because so far I can remember. I remember that, I was in an all-male school, and I remember that was the end of the year play, and they were asking for anyone who wants to do a girl's role. And to me, I remember I just put my hand up. It's very natural for me. I just don't know why, but I was just happy. There's the similar experience of a lot of trans people during childhood. They already know that they are happy to be in their preferred role or preferred gender, but they don't know why. Because there's no language actually, but they know they express that they're happier, and they also express themselves that they are very unhappy to do things like to be expected in their sex assigned at birth role. For example, for me, I prefer to experiment with girls' clothes and anything feminine, and I do not like anything masculine. When puberty hits, it becomes even more difficult for me, because that's when I realize that something's quite wrong with my body. I don't like the hair growth. I don't like the deepening of the voice. I don't like the broad shoulders. And that's when we discover that that is dysphoria. The struggle is real. And then when we try to tell our parents, our family, or our friends, nobody understands us. And then, so it can be very, very, very difficult for us, especially for me coming from a country where trans people has been subjected to violence, even until now, discrimination, that we are not allowed to actually access healthcare, access higher learning. So it's been very, very, very difficult for us, and also for people here too. And in the UK, my patients, they were telling me that their self-harm and suicidality is very prevalent during that time, the teenage years. Just imagine, like during that time when, you are supposed to be living your life and to enjoy your teenage years, but then you are in your own room, self-harming, trying to attempt suicide. The tragic and the sad thing is that sometimes they cannot even share it with their family or with their close friends. And I think that's very sad that there was lack of support during that time. I left Malaysia in the 90s because I just could not continue living there. I could not be who I am. But even those early years, it's very difficult for me even as a medic, to access healthcare. There's no advice, lack of support groups, lack of role models. And then when you want to talk about being trans, there's always a lot of very negative stereotypes regarding being trans. So that really, really scares me when the dysphoria is just so intense that I was almost feeling actually also suicidal during that time. Then I felt that I have to do something myself. I just could not continue living a life as it was. And I tried to reach out for help. But there were also, it's quite difficult, because there's a long waiting list. There's like 3 to 4 years before we can actually access healthcare, in the gender identity service. There's a lot of requirements, you have to change your name before you have to socially transition, before you can access hormone therapy. But for a foreigner, for an immigrant, for me, changing name is not as easy as someone who is born here. I would fear having to go back to my country. And what happens if I go back? I cannot continue working as a doctor. And also, I was just a resident. I was not a naturalized British anymore. So I had to wait so many years. So once I got my naturalized citizenship, I felt that I had better rights, a better support. And even then, as a GP too, as well, I had to wait until I had become a partner, because then I am more a secured position to transition. But was taking hormone therapy like years before that happened. So I was living sort of like a double life, as you call it. But I had no choice. It's not because I wanted to, but it's just balancing the risk and balancing, what you want and what the risk that you have to go through if you transition completely at work. There was also lack of support during that time. GMC was being very difficult of changing your name as a female. But once I have all those in place, because I suppose I was quite lucky during that time, because that was a time when there was more awareness, there was more support for trans people. When I announced in my practice meeting, I said, like, wow, I'm trans, I'm going to transition, I'm going to take 3 weeks off and I'll come back, I'll become Dr. Kamilla Kamaruddin. And, my staff were very, very, very supportive. They gave a round of applause, and they only asked me one thing, how we should tell the patients. And I thought about it. It's a burden for you to tell your patients that I am, because let me tell them myself, I said. And it was a very nice surprise to see that so many patients are very, very supportive. I hardly had any hostility from any patients. Yeah. So that was quite nice. And then there's a lot of support from peer support from my colleagues too as well. But now I think like 10 years later, things are turning backwards. The support that I had from my peers in general practice was getting less and less. And I have actually written about my experience as a GP and a transgender patient. It was published in the British Journal of General Practice about 2017. At that time, I had lots of people coming up to me, and it's very brave, although I don't feel that it's brave. I felt that it's just I had to do it. I think being brave has got nothing to do with it. It's just trying to be who you are. So things I think, are moving backwards a little bit, so it's been very, very challenging now for GPs or doctors who wants to transition at work. But we still have to support them. We are a profession of caring, so
Yeah, I mean, that's such a powerful story of so many obstacles that you've overcome, both personally and professionally, and it being very difficult. But as you say, it felt like something you had to do, a journey that you had to go on. It's sad to hear that it sounds like things feel like they've gone backwards a little bit. So what, as a GP who knows the healthcare system from inside and as a trans person who's seen it from both sides, what do you think needs changing now?
when a trans patient comes to see a GP and says like I'm trans, the worst thing that you can do is to disbelieve them at the first encounter. Just listen to the story. Just listen. And listen to the struggles. Listen to what their difficulties. There's so many things that you can help before they get to be seen by a gender identity service, before they get hormone therapy. Hormone therapy is not the answer to everything. Support, is probably the most important thing for a trans person. Once you listen to the struggles, it probably opens up to a lot of opportunities for you to help your patient. Okay, you have only 10 minutes or 15 minutes to listen to the story. But you can always tell them to come back. It's a process. It's not you say, okay, you need hormone therapy and that's it. Like, no, there's a process of support, a process of affirming your gender and making sure that they have support from the family, from the friends. If there's something that you can actually signpost them to get some therapy from the local therapy, who can help them to actually to process their difficulties in getting support. Also signpost them to trans support groups who are actually very good at supporting patients. There's some other few things that you can do in change the name on the record system. And nowadays GPs can change their name and change their gender without changing the NHS number. So you won't lose all your medical records. So there's a lot of things that the GP can do. So don't think that you have to do everything in 10, 15 minutes. Think of it as a process and as a journey. Trans people also do understand that a lot of GPs cannot just start hormone therapy, but they do expect some compassion.
Yes, and I suppose the beauty of general practice is that you do see people again and again over time, and you can develop a relationship with them and support them that way. And within GP consultations, are there any tips that you would give to GPs about how to manage the consultation?
Language is very important. The first thing you probably could do is that, okay, how do I call you? What's your preferred name? What's your preferred title? And you try your best to call them by the preferred name and the preferred title. You might slip, you might forget because you're so used to see the person as in a assigned sex at birth. And then if you make a mistake, just say sorry and move on. Don't dwell on it because we don't like people to dwell on it. But we do know if a GP is doing out of malice, out of laziness, or at least of not caring for your well-being, we do know the difference. We're very sensitive to all these small things, you see. And as I said, when you want to start something to support trans people, you don't need to start with grand gestures, Start with something small and build on it. Start with showing your kindness, your compassion. So as I said, start asking them, what's your preferred name, what's your preferred title, and then start by actually changing it on the notes, so then when somebody comes in, your admin can also address the patients. It's very validating for a trans people to hear that someone is really calling them by the preferred name or by the preferred title. So that's probably the first thing that you probably could do. And then you move on, you start asking about the story, as I said earlier, listening. And the communication skills is more about listening skills, compassionate language, rather than saying something like, oh, why do you want to transition? That is not the language you need to ask why. We don't wake up one day just want to become trans, but it's a transition, it's a struggle. It's like from a journey. And some patients are also neurodivergent. Your communication skills have to actually to adapt. I've started teaching GPs about underdiagnosis of autism in adults and then changing your communication skills. Sometimes they do not understand nuances, they don't understand jargons, so keep it simple. And sometimes you need to ask direct questions to them. Sometimes they are very sensitive to light, so maybe ask them, oh, do you want it to darken the room a little bit? Sometimes they don't like loud noises. Sometimes you ask them, kind of thing first, what do you want me to do to make you feel comfortable? You might want to have asking them to write something to express their views. There's a lot of adaptations that you can do in your communication skills.
Okay, and then as regards the kind of continuing relationship, there will be people who are on waiting lists, there will be other people who are being seen by gender identity clinics and who need shared care arrangements. Do you have sort of tips for GPs about managing both of those scenarios?
Because of the long waiting list, a lot of patients will go private or self-prescribing on the internet before they get to be seen by gender identity clinic. We can actually provide what we call bridging prescriptions, so that before they come and see us and the gender identity clinic. Bridging prescriptions is endorsed by the GMC And there are scenarios actually where you can consider bridging prescriptions. So it's either when patient is self-prescribing from the internet, or from a private provider, or actually from overseas, for example. It can be dangerous for them to get it from the internet. So you have to explain to them that it is not safe. And I think that the GMC supports you if you want to do bridging prescriptions. And the GMC says that for these kind of scenarios, you can prescribe some hormone therapy at the lowest dose to ease the dysphoria. In a lot of instances, this can work. There's also new guidance about bridging prescriptions. If the provider is a respected private provider in the UK, and a lot of the respected providers in the UK are actually also run by physicians from gender identity clinics. So they would be probably carrying the same thing. I teach a lot to GPs and GPs, trainees. And when you want to consider bridging prescriptions, make sure that they have a good support network. That's very, very important. They have a good support network from the family, especially from the friends and the colleagues and the workplace. And secondly, you ask when if they change the name, because changing a name validates the gender identity, and the mental health is stable. So if they have all these protective factors and they have been on hormone therapy for at least 6 months, and they tell you that the hormone therapy has improved their well-being, by all means, I don't think you can do anything wrong in continuing the prescribing. Don't feel that it is a dangerous thing to actually to prescribe. And prescribing hormone therapy is actually quite simple, quite straightforward. We all have got the experience in prescribing hormone therapy, estrogen, testosterone, generation blockers, generation analogs. We all have got the experience. And actually, if they come to my teaching and assess all the teaching materials, you can actually find out that the clinical risk is actually very, very, very small.
So are there other things that GPs can do to support while people are on the waiting list?
Yeah. So these are for those waiting lists. As I said, if you give them that impression that you are caring for them, that is very, very important. That you're caring, you're compassionate for them. There are things that you can actually do. You can signpost them to trans support groups like transsexual, gender intelligence. They're very good at supporting them, and they might need some therapy. So you can refer them to a local therapy, the talking therapy, to help them with their anxiety and the depression, coping with this gender incongruence. And then if they are self-harming or suicidality, refer them to the CMHT. There's a lot of things that you can do to support them.
And then once a person gets to being seen by the clinic, how does the GP's role develop at that point?
There are a lot of GPs in transgender healthcare who are working in gender identity services. For example, East of England, we're a satellite service from Nottingham Centre Transgender Health, which is an amazing setup because then we have access to expertise, psychiatrists, psychologists, speech and language, and there's a lot of pathways that we have access, complex follow-up pathways, forensic pathways. GPs are very good at actually managing patients, and then up to a point when we cannot manage, then we know when to refer. I think GPs are excellent of doing that. I mean, that's what we're trained to do. When we do the assessments, and then when we have 2 assessments, then we second assessment after the diagnosis, and then if we think that the patient has a diagnosis and the readiness to start hormone therapy, then we will write to the GPs to start hormone therapy. Unfortunately, we are not commissioned to do the prescribing, so prescribing actually lies to general practice. And if the GPs have got difficulties or unsure, always ask us. We have a lot of advice and guidance, and we respond to the advice and guidance within 24 to 48 hours. It's not like you have to wait weeks or months to get the advice and guidance. So it's a lot of support that we give to our GPs to continue prescribing.
Presumably GPs can see their local gender identity clinic as a source of perhaps teaching, information, and certainly advice about the day-to-day management.
And I do a lot of teaching. I teach a lot in the GPs and GP trainees, and I go all over the UK to do that. I'm very happy to travel. I really enjoy teaching GP trainees because they're so inclusive, so engaging, and they're really, really trying to help.
And once people have transitioned and they're further along on their journey, presumably the GP's role then is different. It's like looking after them as a person in their new identity and ensuring the healthcare is optimised.
90% of the patients who have accessed gender hormone therapy, their well-being has improved. There's totally different people, what you see them now. They're much happier, they're much more confident. The anxiety and depression is much more manageable, less mental health issues. And there is lifelong treatment. There's some things that you need to think about. Some of them still need cancer screening, especially those with a cervix, they still need cancer screening. Those who have now transfem, who have breast tissues, so they require breast screening. The good thing is that we have authored, together with some of the few of the GPs, we have authored top tips for GPs about lifelong care. The good news is that RCGP has endorsed these top tips, and so it's only just been released. So we're very happy about that. It's been endorsed with RCGP, and then we are trying to distribute to all other GPs about that.
That's fantastic. That kind of leads me on nicely to my last question, which was, what resources are there for GPs who have been listening to this and thinking this is something I really need to know more about? Where would they go to find help and support?
The RCGP has launched an e-learning for transgender healthcare. Yeah, it's on the website. I've also done some videos. It's on the HEE website too as well. And then if any GPs want some teaching, GP trainees want bespoke teaching, reach out to me. I'm very happy to provide, teaching face-to-face. I prefer an in-person teaching because it's much more interactive and it's more fun for me, or for both of us actually. Teaching should be fun. Teaching should not be like didactic and telling them what to do kind of thing. So I don't believe in that. And also I think the new trainees also don't believe in that either. So it's very much interactive and very much asking them, what do you know, rather than telling them what to do.
Yeah, because I guess people may have a certain level of knowledge and it's like meeting them where they are and topping up that knowledge and helping them to feel more empowered to support patients. Just to mention, on MIMS Learning, we also have a 3-part series on transgender healthcare written by 2 GPs. So that's another resource that we can offer our end. Well, thank you so much for talking to me today. Is there anything else that you'd like to say that you think is important about this area?
Yeah, my philosophy in trying to improve health inequalities actually stems up from, I had inspiration after listening to Michael Mormoth's speech at the RCGP conference. And I just remember when he said, do not blame the poor people, but blame the poverty. And it's the same thing with trans. Do not blame trans people, but blame transphobia and misogyny and discrimination. It's a driving force behind me to address and to improve health inequalities among all marginalized communities. It's a powerful thing.
Thank you so much for sharing so much with us today. It's been very moving listening to you and to hear what you've overcome and where you've got to today, not only a practicing professional, but is also teaching others and inspiring others to know more and to do more to support people. So thank you very much for your time.
Thank you for inviting me. It's been such a huge privilege.
We'll provide links to the resources that we mentioned during this interview on our show notes. And as a listener, you can also go to our website at mimslearning.co.uk and complete this interview as a module there and claim your CPD certificate. This episode was produced by Jude Owen. Please do join us next time for more practical clinical information to support your practice.